Hello, everyone. Welcome to another webinar from the Steps Forward Innovation Academy. Today's topic is establishing an AI governance framework. Over the next 45 minutes, we will discuss key components of clinical technology governance to help ensure the responsible and effective use of AI across healthcare organizations and practices. Please note that this webinar is for informational purposes only and is believed to be current and accurate at the time of posting. Please consult a professional advisor for specific medical, legal, financial, or other advice. References and links to third parties do not constitute endorsement or warranty by the AMA. And let's just take a moment to go over your experience today as an attendee. You can access a selection of resources related to our webinar today, including the slides, the AI Governance Toolkit, and a recent Future of Health report. You can also submit questions for our speaker to answer live today. If you're joining us on YouTube or LinkedIn, welcome. You can follow the link in the description to join us here on Zoom, access the resources, and ask the questions for our speaker to answer. Once the event concludes, you will be presented with a brief 2-question survey. Please take a few seconds to give us feedback as it helps us tailor our programming choices to your wants and needs. Also, after our webinar concludes today, you will be able to claim 0.75 continuing medical education credit hours. You can follow the link in the resources tab to the AMA Ed Hub and claim the credit there. Also, you will see a link to our upcoming webinars. Please consider checking out the programming we have planned for the rest of the year and register there in just one step. We'll remind you of all of this at the end. But for now, I would like to introduce you to today's speaker, Dr. Lozovatsky. Take it away, Dr. Lozovatsky.
Thank you so much, Alec, and thank you for joining us to talk about this very exciting topic. Before I dive into AI governance, I would love to take a minute to introduce myself. My name is Margaret Lozovatsky. I am a pediatrician. I practice as a pediatric hospitalist, and I am the Chief Medical Information Officer and the VP of Digital Health Innovations at the American Medical Association. Prior to joining the AMA about a year and a half ago, I have been in multiple CMIO and CHIO roles across various health systems. And so I'm thrilled today to talk to you about a topic that is near and dear to my heart, which is governance, a topic that's very important to many of your organizations. Today, during our webinar, we're going to talk about what a framework for AI governance would look like. We're going to talk about how clinical informatics can help support technology implementation and utilization. And we're going to talk about strategies for measuring success of your governance frameworks at your organization. Next slide, please. So before we jump in, I'd like to take a minute to define AI and talk about how we think about AI at the AMA. While we know artificial intelligence is broadly referred to as the ability of computers to perform tasks that are typically associated with rational human beings, at the AMA, we recognize that the technology today continues to require a human in the loop. And so we talk about an alternative conceptualization of AI titled Augmented Intelligence. And that is really, again, to recognize the fact that clinical decision-making still lies with the clinician, and the AI technology augments the clinician's ability to make decisions. Next slide. We at the AMA have done a survey of physicians across multiple care settings, and there will be links in this webinar to all of the results of the survey. But we wanted to highlight some of the more common uses of AI in clinical medicine today. And what we found through the survey, which we did first in 2023 and then repeated again in 2024, is that the top uses were within documentation, billing, charting, largely within discharge instructions, care plans, translation services. And what we also found is the utilization rates had increased significantly between 23 and 24, which means that you're probably all seeing these technologies being used in your organizations. Next slide, please. And this is a deeper dive into the various use cases that I had just described. What you see here again is a lot of uses within documentation, translation. Chart summaries are areas where we're starting to see more AI tools out in production. A lot of interest in automation. When we asked physicians what they were most interested in, we see a lot of responses focused on the administrative tasks within clinical medicine, which often, as we'll talk about, are seen as the first great opportunities to automate things. Next slide. So as we think about all of these AI use cases, the question comes up as to why are we talking about AI governance, which many of you are probably thinking about. It's really important at this point in time as the technology utilization I mentioned earlier had almost doubled. It went from 38% in 2023 to 68% in 2024. So as these tools are being rolled out across the clinical spaces, we really have to think about how to standardize the rollout of the tools, how to think about long-term utilization, ensure that we are doing this in a safe, thoughtful manner, such that we're supporting care for our patients and supporting our clinicians in their ability to deliver that care. Next slide, please. And so I want to also take a few minutes to talk about the various types of AI. We know that there are different ways that AI tools are being used in the healthcare space. And when we think about machine learning techniques, there are various approaches that we can be discussing. Some of it is supervised learning, which means that there is an input, the tool learns the pattern and provides an output. There's also unsupervised learning, where there's an input, but the learning process is not being supervised, and then there's an output. And then there's the reinforcement. As the tool is learning the various patterns, there is a reward pattern to ensure that we are getting the appropriate outputs. Next slide, please. So what is the relationship between AI, machine learning, and deep learning? And this is a great way to represent that. So within this bigger umbrella of AI, there is machine learning, and then there is deep learning, which requires longer training time, and there's more complexity to the computational processing requirements within the deep learning algorithms. As we're thinking about all of these different technologies within our clinical environments, there are many considerations for us to consider. Next slide, please. And I would encourage you to take a look at the toolkit to look at the specifics of each of these topics, but it's really important for us to understand, again, the critical need for governance in this space, because there are many risks to implementing these technologies without appropriate governance in place. We know that bias is certainly a consideration, and as we're looking at our existing data sets, which certainly have some bias in it, the fear is that as these tools are learning off of the data sets that exist today, there could be a risk of exacerbating the inequities that exist in clinical medicine today. Topics such as explainability and transparency are really important because often the algorithms that are implemented provide an output that the clinician is going to be responding to. We need to ensure that the clinicians understand what the inputs are so that we can appropriately evaluate the outputs. There's a lot of discussion about liability. We know that these outputs may be used for clinical decision making. So who does the liability lie with, as clinical decisions may be based on the use of the algorithms? Data privacy and security continues to be very top of mind. We know that our patient data is entrusted in our clinical environment. So how do we ensure that we continue to keep that data private, secure, and offer all of our patients appropriate protection? And then things like hallucinations and confabulations. A really good example of that is I had recently looked at some of these models and I asked a very simple question: what are things that patients can do when they have a UTI? And one of the outputs was that they can drink urine, which of course all of us might chuckle at. And most likely what the tool wanted to tell me is that patients should hydrate well until they have clear urine. However, not all of the hallucinations are as obvious as this one. And so understanding how to properly evaluate the outputs of these tools is going to be really, really important for all of our clinicians to gain trust in their ability to utilize the tools in real patient care scenarios. Next slide, please. So we're going to go over the 8 steps that you will see in detail in our AI governance toolkit today. High level, really starting with establishing a structure for governance at your organization and having appropriate partnership with your executive leaders to have accountability for this work is going to be a first step. And then creating a working group that is going to do a lot of the work to set up the pieces at your organization that are going to be necessary to develop policies, to assess these tools, to have a plan for implementation, and very important to think about long-term oversight and monitoring processes, as well as supporting organizational readiness to ensure that not just the people that are engaged in the conversation, but all of our clinicians are ready to utilize these tools as they deliver clinical care. Next slide. So let's dive into step 1. What does it take to establish executive accountability and governance structures? It's going to be important from the beginning to really consider what your institution needs and to charter governance at all levels. You're going to be thinking about the intake process. You're going to be thinking about how to keep your colleagues engaged, how to ensure that all of our clinicians are aware of what is being rolled out in their clinical environments, to upskill our colleagues to utilize these tools perhaps in a different way than they've utilized technology before. We know that over the years, many of us have had some training in the utilization of technology, and we also know that these technologies are now moving at a speed we have never seen before. As I mentioned in our survey, we saw utilization nearly double in 1 year. I have personally never seen this speed of development and adoption of clinical technology in my experience as a clinical informaticist for the last 20 years. And so we need to make sure our colleagues are engaged and knowledgeable and properly trained in how to evaluate the outputs of the tools. And setting up a process that has transparency and accountability is going to be really important as we dive into each of these steps. Next slide, please. So, how do you establish clinical governance? First of all, you probably already have some sort of a process for how to evaluate technology at your organization. And you may think about embedding these AI tool evaluations into that existing process. Or you may think about creating a different process that then ties into this existing model. But at a high level, having your executive leadership that sets direction and delegates the work to some existing councils would be helpful. Having advisory councils that are there to do a lot of the work. I like to say that's where the sausage is made. And then engaging all of your specialty areas where decisions can be made closest to the care. I always say that our cardiologists know what they need in the cardiology spaces better than I do as a pediatrician. And yet it's going to be a partnership to translate what their needs are to the development and design of the technologies that will be implemented. And so having a process where you have your specialties engaged and then you have some structures that allow you to evaluate the technologies and understand how they all work together in a very complex integrated environment is going to be very important. Next slide, please. At the highest level, as we talked about, it's going to be critical to have buy-in from your executive leaders. And every organization is structured differently. However, engaging your CEO, your CMO, CNO, CQO, all of the C-suite is going to be critical. We know that all of these areas are going to be impacted by AI, and getting the buy-in of those leaders that this is an important initiative at your institution is going to be very important. Of course, having a clear partnership with your technology leaders is going to be critical to successfully bringing these technologies on board, and understanding that the clinical leaders and the operational leaders are also very important in this conversation, because much of the technology implementation is going to impact the areas that they have accountability for. So getting that buy-in from the beginning, from the C-suite, is going to be a very important starting point. Next slide, please. I want to take a minute to talk about clinical informatics, particularly as we think about AI tools in the clinical environments. As many of you know, it is now a board-certified subspecialty, and these are really your clinicians that have training in how to implement technology, how to think about the change management that is required to make these technologies successful, how to gain adoption, and ways to think about optimizing the technologies, monitoring them over time. So a good rule of thumb is to bring your clinical informatics leaders into the conversation early so that you can ensure that there's a partnership with many of the clinical spaces. I like to think about this group as the intersection between the needs of the technology teams, the clinical teams, and the health system. And so having them as part of this multidisciplinary approach, as we discussed with all of the other C-suite leaders, is going to be very important to successfully implementing these technologies. Next slide, please. So how do we establish accountability and a governance structure? There's some important questions to ask before you think about the structure. And the first question is really, how does adoption of AI support our strategic goals? I've talked to a lot of people that have been focused on setting an AI strategy. And often what we have discussed is, rather than setting an AI strategy, perhaps think about how can AI as a tool support existing strategies at your organization. So it really becomes a supporting mechanism for the strategic imperatives of your institution. It's important to think about, is your organization the kind that wants to be an early adopter, or is this more of a wait and see approach? Do you already have technology partners? Do you have existing expertise at your organization? Do you have experts in cognitive computing that are able to evaluate these tools? What can be utilized that exists today? Who will be accountable for the deployment of these tools? Should your organization incorporate AI into existing structures, or are you going to need new committees, new groups, perhaps even new roles at your institution? And this will differ based on your environment, but these are all really important questions to ask before you dive into your governance model, development and design. Next slide, please. One way to think about the formation of your work group, which will be your second step after you have developed a model for governance, is to think about a multidisciplinary approach. So we talked about engaging all of your C-suite leaders. They're going to provide direction. They are hopefully going to provide support and have accountability for this work. And it will be important to consider who they will delegate some of the details to, such that you can start to design the next level of governance. And I really think of these partnerships as multidisciplinary, including our physician leaders, our nursing leaders, partnering with the clinical informaticists to create a group that will then work through many of the questions that we discussed. Now, I know you see physicians and nurses on this slide, but we all recognize our clinical environments are much more complex than that. So this is going to require our operations folks. It's going to require including our pharmacists and many of the other clinical specialists, OTs, PTs, whatever the areas that you're thinking about, it is critical to have people that are delivering care in those spaces as a part of the conversation because they understand the considerations best. These are the folks that are going to think about how to approve requests, how to provide directions for the requests. They're going to ensure that you are adhering to your guiding principles at your institutions. They'll help with setting up prioritization processes. And having a multidisciplinary approach to all of these steps is going to be critical for us to represent the complexity of the clinical environment and meet the needs of all of our clinicians so that they can deliver the best care to our patients. Next slide, please. So, how do we assess the current state and establish priorities? This is a really important question for us to think through because we know that every organization has some sort of prioritization process. However, it is not always the optimal prioritization process. So when you think about your institution, it's important to understand the current state. And what you see on this slide is an example of a current state analysis that was done at an institution where I had worked in the past. And you'll start to really understand what are the ways that things are done. Often when you do a current state analysis, you may realize that the processes you have in place today are not functioning the way that you had thought they were. One of the current state assessments that I had done at an institution found that, for example, requests were coming in 10 different ways, whereas we thought there was only one pathway. And so understanding how are you getting your technology requests today? Are the clinical areas coordinated? Who is doing that initial assessment? Do you have clinicians in the loop? What is the experience of your clinicians today? Are they happy with placing a ticket? Do they feel like they're playing phone tag all day long? Do they know what happens to their requests? We hear a lot about these black hole scenarios where people say, well, I no longer ask for anything because I feel like every time I ask for something, it just goes into a black hole. And so understanding what that looks like in your organization is going to be very important. Most healthcare organizations are already using AI tools. So doing an analysis of what tools are you using today? Where are you in your organizational readiness is going to be very important. Next slide, please. So as you're thinking about the current state, you'll also want to consider what are your priorities. So one way to think about is how do they relate to the goals of your organization, which ultimately fit within the quintuple aim framework, right? So your organization is likely looking at access to care. It's looking at the clinician experience, the patient experience, the quality of care, and of course, everyone is thinking about cost. And you can start to consider as you're looking at the various tools that you may be considering at your organization, how do they fit into this framework of, is it easy to implement, difficult to implement, what's the clinical impact, and how is it going to align with the strategic initiatives of your particular institution? There are many ways to prioritize work, and we'll talk about that in a little bit more detail in a minute. But this is one framework to consider, such that we're really looking at how it aligns with the quintuple aim, which ultimately is the way that we think about delivering the best care. Next slide, please. Another very important consideration as you think about your current state and you're thinking about establishing priorities is how to quantify the value of these technologies. This is a topic that comes up a lot. A lot of leaders have come to me and said that I have this really great tool and I'm not sure how to get support at my organization. And so this is one way for you to consider demonstrating value to your organization as you are thinking about these technologies. And often the first question that you will get is, well, how much does it cost? And particularly some of these new AI tools have a really hefty price tag to them. And so if you come with the cost as the one topic to discuss, it is difficult to communicate the value. Tying that value to the patient experience, is it going to improve access, for example? The clinician experience, is it going to impact our clinicians' burnout rate? And of course, quality and outcomes. These are all part of that quintuple aim that we think about. But as a whole, this is a way to consider value. And for each technology, you may have a different way of communicating, for example, how it impacts the clinician experience. If we take something like ambient dictation as an example, you may have a very strong improvement in the clinician experience, and you may be able to tie it to the patient experience because there's some great data that is coming out of organization that shows that there's a positive impact there. And all of these can be tied to improving the patient access, for example. So seeing more patients, which ultimately will offset the cost of the tool. And sometimes you have to be a little bit creative as you're thinking about these technologies to be able to predict how they're going to impact all of these different measures, but having an equation in mind and a framework in mind where you are consistently evaluating tools in that way can be helpful as you're thinking about prioritizing the use cases. Next slide, please. This is a visual of how many technology teams think about the work that they have to do. And I really like this visual because the can is a finite amount of space. And within the can, you have your really large projects. So many of them are things like upgrades and other projects that are to keep the lights on. So they have to be done. And then you have the pebbles and the sand, which are some of the smaller projects and the day-to-day improvements. Understanding that there may not be a lot of space in that, very important for you to come up with a way to prioritize the implementation of these tools. And there are many frameworks. Some of them are very complicated that are looking at that value equation in a lot of details. And some organizations have found that just prioritizing low, medium, high is one way to get these improvements into the system more quickly and have a more nimble process. Whatever you choose, it's going to be important for you to be transparent with your end users on what that process is and make sure that everybody understands where their requests are as you're thinking about the AI tools that you're hopefully evaluating at your organizations. Next slide, please. So the next step is to think about AI policy. And we know that while you may already have a governance model for your technologies, there are some unique features around AI that you're going to need to be thinking about. And this working group that will be multidisciplinary will be one space where some of these things will need to be discussed. And it's going to be important to have some clear definitions and to have clear understanding of what your organization is going to allow. For example, a question that comes up all the time is, which of these generative AI tools will we allow in our clinical environment? Having clarity, having policies, creating these guiding principles from the beginning is going to be critical as you consider how you proceed with selecting and implementing these tools. And one really good example of a guiding principle that is important to consider is how much variation are you going to allow? You will get requests from different specialties, different locations within your environment. And it'll be important to have some clarity on the guiding principles of what is your organization's stance on these policies. And it'll also be really important to continue to evaluate these policies as we know the space is changing very quickly. Next slide, please. So as you think about the development of the policies, I would encourage you to take a look at what exists today. I suspect you already have policies on informed consent and data use and data and security policies, inventory management, all of those things exist. So one question will be, what needs to be updated within the existing set of policies? And another question will be, is there a need for development of new policies that may be unique to this space that are not covered within what is existing in your organization? Next slide, please. You're also going to need to define your intake process, your vendor evaluation process, and the assessment process within your institution. And again, you probably already have a vendor intake process. You probably already thinking about intake and how to evaluate technologies. And yet, there will be some very unique features of AI that will be critical to embed into what exists today. For example, you probably in the past have not considered every algorithm within the technology that exists. And it'll be important as you look at your policies to align your policy to any changes that you make in your evaluation process of the vendors. And to think about what unique features of AI need to be thought about. Do you have the right skill sets in your organization, the appropriate individuals to do this evaluation? And as you integrate these tools, because remember, these are all tools within your current technology infrastructure that will then be integrated into the clinical environment, what are the unique features of the integration that need to be considered before they become clinician and patient facing? Next slide, please. Clinical input. This is a very important part of your vendor evaluation. And you may or may not have clinicians embedded into this process today, especially as AI becomes more and more integral to our ability to deliver care. It's going to be really important to have clinicians in the conversation so that as you're thinking about how these tools will be used, what clinical decision making will be necessary as the tools are integrated? What are the specialties that will be impacted? What clinical environments will be impacted? It's going to be very important to make sure that you have clinicians in every part of the conversation and that you have your clinical informaticists who really are experts in the space deeply embedded into the process such that we understand the clinical outputs that will be present. Next slide. It'll also be important for you to update your standard planning and implementation process. Again, you've probably implemented a lot of technologies in your organization, and yet there are unique features here. And so having a project plan, a budget, a timeline, having appropriate testing and evaluation is going to be critical. Reviewing and getting all of these things approved. Having a plan for implementation and go live. So what happens on day one? What happens a week later? What happens a year, 5 years from now? Having team members in the process is going to be really important. And then having some sort of performance monitoring, ensuring that there is clear monitoring steps at your institution where you know how these tools are performing, setting those KPIs from the beginning, and evaluating these tools over time is going to be critical. And I would say that this is an area that we have struggled across the industry and for a long time because we have rolled out technologies, and as both clinical guidelines change and technologies continue to evolve, not every organization and every practice has really focused on the monitoring and evaluating piece over time. And particularly with AI, when we know that there's all the risks that we discussed early in the conversation, it's going to be critical to have a monitoring process from the very beginning before these tools are hitting the clinical spaces. Next slide, please. Having oversight in a monitoring process, as I mentioned, is critical. It's going to require a multidisciplinary team. You're going to need to have your technology experts monitor these tools to ensure that from a cognitive computing perspective, they are functioning as expected. It's going to be important to review the regulatory guidelines over time and understand as the regulatory space evolves, how your environment needs to evolve. There has to be a process for our clinicians to provide feedback. One of the things we heard across the board in our survey is that clinicians are concerned about trusting in these tools. And they're partially concerned because they're not necessarily confident that they will have the ability to provide feedback in real time and that feedback will be heard. I think ensuring that your organization has a space for that and being very transparent about it is going to become more and more critical to us gaining trust from our colleagues. And communicating results. If you're monitoring these tools, it's important for everyone that's using them to see how you're doing that, what those outputs are, and to see that if there is an issue, and we all recognize that optimization of technology is a never-ending process, that you are addressing that issue right away, and that there's clear, transparent communication pathways for clinicians to know that when they have an issue, they're able to get it addressed. Um, I have been involved in implementation of many of these AI tools over the years, and one thing that I've learned is having that feedback loop, the clinical input is going to be more and more critical because even with the best intentions and the best design, it's not always straightforward to expect the outcomes that you get. And so being able to pivot and make sure that we are monitoring those outcomes is going to be important. And if you think about the way that we've rolled out decision support over the years, we have often added more and more alerts and haven't taken them away. And so there is a huge risk of adding more and more if these monitoring processes are not put in place from the very beginning. Next slide. So supporting your AI organization in all of these initiatives is going to be, as we mentioned, a multidisciplinary process. But it's important to think about all of the groups that need to be engaged that are outside of the clinical spaces too. Having your marketing teams, your compliance teams, your biomedical engineering, your legal teams, all of these spaces are going to need a seat at the table as you're thinking about rolling out these tools, not just in the clinical spaces, but also in the administrative spaces. And having a partnership across all of these areas so that you have appropriate oversight, creating the right steps of how you think about oversight is going to be important. We often think about clinical and non-clinical, and yet our healthcare environment is too complex for us to keep those spaces separate. So ensuring that all of these teams are working together, for example, even in the supply chain space, all of these tools are being used in the clinical spaces. So if you're rolling out a new technology, it's important for a clinical voice to be at that table to provide input as to how it may impact clinical care. The areas like marketing and public relations and communications are also critical to communication and improving adoption and providing appropriate education for our clinicians. Next up, please. So as you think about supporting your organizational readiness, it's going to be critical for you to really use some of the best practices in process improvement. And this is an area that hopefully you've already embedded into many of the processes at your institution, but starting from a place of what is the problem I'm trying to solve? How am I going to modify the existing environment with the technology in mind to ensure that I am ultimately solving the problem that I started with? And what are the right steps for planning and executing these projects? Often we think that it's a pretty straightforward plan, do, study, act. However, next slide, please. We all recognize that the reality is more complex than that. And there are many curves in the road of process improvement and optimal technology implementation. And then, of course, the optimization that goes on forever because we always want to make sure that we're addressing the needs of our clinicians. And so having this continuous improvement mindset is going to serve you well as you embark on this journey of development of AI governance at your institution. Next slide, please. And finally, what I will say is that it is a journey. We're all learning. These are new technologies to all of us. They have, as we talked about, changed at speeds that are unprecedented and will continue to do so. And so thinking about all of these steps, building an infrastructure at your organization to be successful in the implementation and utilization of these tools is going to serve you, your clinicians, and all of our patients well. And with that, I'm going to invite my colleague, Amanda, to facilitate the questions portion of this conversation. And thank you for joining us.
Thank you so much, Dr. Lazadatsky. It's so helpful to walk through each of those steps. And I just want to call everyone's attention to the fact that if you go to the little dot, dot, dot icon at the very bottom where it says more, that will bring up the resources that Dr. Lazadatsky has discussed today. So if you're new to the interface here on Zoom, you can find all of those resources there, the Future of Health report, the AI governance toolkit, and then the research on physician sentiments on augmented intelligence that we discussed. So we have a few questions. Some were submitted in advance, and I just got a great question submitted into the chat. If you have a burning question, feel free to drop that into the button where it says Q&A. It's not in the chat function, but there's a specific area for Q&A where you can reach out to us with your questions. But the first question we have for you, Dr. L, is how do you suggest we validate and monitor the growing number of generative AI programs that are being released as embedded features? So in our typical enterprise software, thinking about the example was given in Outlook, and then features of Gen AI that are being embedded into the existing EHR pathways.
Yeah, thank you for asking that question. I think that that is a challenge for all of us that we're still learning about. And you're absolutely right that many of these technologies are embedded into our existing technology suites. And so the first thing that I would say is that it's a partnership with the vendor. So understanding that there is transparency between you and the vendor of what tools are being embedded is the first step, and having those honest conversations. And then thinking about what are the skill sets of individuals that you need on your team to have initial evaluation and monitoring, but also ongoing processes to continue to monitor the outputs of these tools is going to be critical. And I had mentioned that it will likely be important for all of our environments to think about having some sort of cognitive computing team, having that expertise on site. And I also understand that not every practice environment is able to do that. So partnering with the vendor to have a plan for how you're going to be evaluating the tools in a longitudinal fashion is going to be really critical in those settings where you don't have the expertise in-house.
Okay, wonderful. Thank you. And then a question came through about the best practices in using AI in graduate medical education. And how have you seen that working?
Yeah, our teams at the AMA, and we all work very closely together, have been thinking about that question for several years now and have done a lot of really great work. And I would encourage you to look at some of the educational modules on the AMA website to first start to think about how do we upskill our learners, so both undergraduate and graduate education settings, and also our practicing physicians today who may not have been exposed to any of that in our training because these technologies are so new. And one of the things that we talk about is this precision education, that these technologies will allow us to, first of all, think about the educational space slightly differently. Because while many of us were trained in an era where we had to memorize all of our facts, we now have access to information, and the skill sets of our learners may need to evolve as the technologies evolve, but also to think about how to embed the education of the use of technology into our current educational setting. And again, lots of really great information on our Ed Hub. So I can have our team add that to the materials that we share with the webinar.
Yeah, absolutely will do. So in step 7, you talked about establishing an oversight and monitoring process. And then at that last part, it's about communicating the results. So we had a great question come in around that time about how you think about evaluating projects when those results start to come in and they're poor. Poor outcomes, you're not seeing the results that you want. How do you think about, who's making the decision of a go, no go, or a go, continue, or let's adjust and change that? And are some of those decisions made up front? How do you engage in kind of making those decisions when you start to see poor outcomes?
Yeah, these are really difficult scenarios. And I'm thrilled to hear somebody ask the question because these are the topics that nobody wants to discuss. We all want a successful project. And the reality is that if you look at that winding road in one of the final slides, we know that's a more realistic scenario than the perfect implementation. And so I think that there's a few pieces to your question. The first part is if you are seeing poor results before the implementation, how do you make a go and no go decision? And I would encourage you to define what poor means before you are in that scenario so that it's very clear whether it's a go or no go decision. But also, I think it's important to recognize that when you're put in those difficult scenarios, in those situations, this shouldn't be a one-person decision. This is really why you need a multidisciplinary approach, that so that you do have clear KPIs that you've defined, you know what you need to do to be able to go live with these technologies, and you have the right stakeholders to be able to make the decision of what happens next. And I also wanted to comment on the fact that sometimes these poor results come in after implementation, and that can be even more difficult. And many of us that have been in the technology implementation space for a long time have experienced that. Sometimes you go live with something and it is not working as designed. And again, having the right leaders that have accountability, oversight over those spaces, escalating appropriately when you're seeing results that are not what you were hoping for is really important. And I've personally been in those scenarios where we had those outputs escalated to us early and we were able to pivot and pull out technologies that weren't working and redesign things as quickly as possible to ensure that we put the safety of our patients first. And so I think having those conversations and having the processes in place to be able to pivot quickly, especially with the speed of evolution of these technologies, is going to be more and more critical as we see AI embedded in many of the things that we do.
Yep, absolutely. And as we mentioned, the doubling of augmented intelligence tools in healthcare and that rapid growth through the research that we did back in November 2024, we had a question just come in about the tools that you're seeing be used the most. So any fan favorites that you want to share?
Yeah, absolutely. So we will share the slides, and in one of the slides, there was a breakdown of what was reported by individuals as what they were using. And again, that was about 6 months ago, so things are moving quickly. I would say that from an AI perspective, we've been using AI in healthcare for a long time. A lot of predictive analytics have been embedded in our clinical environment. That is what I would say is probably being used the most. And in the last year, we have seen huge gains in the utilization of generative AI. And the tools that we have seen the most are ambient. I would say that's by far and away the top tool that is being discussed and is being utilized. But we're also seeing some of these Gen AI tools being embedded in the in-basket responses. We're seeing it in summarization of chart specific areas, and that is being utilized across the board. I have seen it used in inpatient, ED, and ambulatory in all different settings, and many subspecialties are really thinking about these summarization tools that are specific to their area. I suspect that this will continue to evolve, and if you watch this in a few months, they'll probably be outdated. Um, but that is where we are today, is that the adoption of these tools is just moving incredibly quickly.
Yep, yep. And there's so much more to discuss. And as you said, we will be continuing this conversation through a number of the different programming that we have going on here at the AMA. Have time for one last question, just a couple minutes left. Someone asked about any models that involve consumer or health plan enrollees input, and what are your thoughts on how AI can be supportive in engaging directly with health plans?
Yeah, that's a great question. And I think probably still evolving how AI will be used with partnership with health plans. Right now, a lot of the health plans are embedding these tools in their own environment, and we are watching that very closely to understand how some of the tools in the clinical spaces will interact with what the health plans are doing. And again, this is still very much an early iteration for how we're going to utilize AI in those spaces. And ideally, as we think about some of the administrative burdens that could potentially be relieved, this is a space that's ripe for us to think about getting the information to the health plans in the right way and really supporting our clinicians in that way.
Absolutely. All right, with that, I'm going to pass it back to Alec, who can share additional resources and ways for everyone to stay engaged with us.
Awesome, awesome. Well, thank you both so much for your time and expertise and having a great discussion here at the end. I'm here to take us out again as a reminder, just like Amanda mentioned, all resources that we think are relevant to today's discussion, as well as the slides, are available for you to access on your bottom menu. There's a resources button. If you don't see it, click that collapse dot 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 button and it should be available there. Other things I would like to let you folks know about. Where are we? Where are we? My apologies. This recording will be available to review on demand and include, you will still have access to all the slides and resources. If you are looking for more digital health content, our next webinar will be a week from today, focused upon enhancing behavioral health integration with digital solutions. We'll explore how healthcare organizations are evaluating digital health solutions to BHI, including an overview of the Peterson Health Technology Institute's latest assessment of the clinical effectiveness and budget impact of many available solutions in the market today. You can scan this QR code to register now or follow the link in that resources tab. When we conclude today, I would like to let you know that you will see our feedback survey. Please take the time to answer the 2 questions there. Your responses help guide our upcoming programming to deliver webinars you want to see, such as the one you saw today. And one last pitch for you folks, if you're looking for something a little more interactive from Steps Forward, we would like to invite all attendees to join us for our next Saving Time Practice Innovation Bootcamp here in Chicago this September. This 2-day in-person bootcamp is specifically designed for clinical and operational change agents looking to eliminate unnecessary work and free up more time to focus on patient care. And I believe Dr. L is joining as faculty in September, so you would have a chance to work with her one-on-one for 2 days straight. If you have interest in attending, you can scan the code on the slide right now. For additional resources and guides to support your physicians and staff, including those on digitally, please visit the American Medical Association website or stepsforward.org. Thank you for joining us, and we hope to see you again soon.